Hey there, Dr. Luke here. Today we're going to do a spinal segmentation work with a controlled articular rotation as well. The equipment that we need is a band, if you have one, any band, a sock, and we're going to need some yoga blocks as well. Spinal segmentation is the foundation of spinal movement and spinal health. We want to have individual control and segmental range of each vertebra moving up the spine. If we don't, we're going to have problems. So this is working on getting that spinal flexion and extension and retraining those areas of your spine that aren't moving very well. So let's give it a go. Okay, controlled articular rotation for our spine. Let's breathe in and irradiate. We're going to go into flexion, rotation, lateral bending, and extension. Keep extending, rotating, lateral bending, rotation, coming into flexion. Let's do that again, to the right, extending, rotating, lateral bending, slow and controlled. Find that workspace. Best possible rotation that you can get, and final one for this side. Coming back into our neutral position. Okay, let's go to the left. Let's flex, rotate, lateral bend, extend, rotate, lateral bend, rotate and flex. Explore that best possible range in that pain-free range. Good, last one, really explore that best possible range. Great, and into that neutral position. Fantastic. Okay, that's spinal segmentation on all fours. Starting off an extension, breathing in and irradiating. And I want you to just generally get flexion and extension in the spine here. Feeling for where those restrictions are on your spine, and just get a general sense of how things are functioning. Okay, breathing in and irradiating into extension. And now let's focus moving one segment at a time. So we're going into now posterior pelvic tilt. We're moving just only our pelvis and lower lumbar. Moving up to upper lumbar and then thoracic. And then thoracic spine and cervical spine. Looking to your knees, squeezing up into flexion. And now we're initiating from our lumbar spine, going into extension. Slow and controlled, one segment at a time. Again, initiating from our lumbar spine into posterior pelvic tilt. Up to our neck, flexing into extension, anterior pelvic tilt. And into our extension. Let's go 2 more times. Posterior pelvic tilt into our flexion, one segment at a time. Really slow and controlled, really explore the workspace that you have and focus on the areas that you're having trouble with. Fantastic. Now what we're going to do is isolate just your lumbar spine only. So what we're going to do is bringing you on your elbows here like this. Find a comfortable position. And now we're going to start off an extension, breathe in and irradiate, and we're going into flexion. Slow and controlled. You'll notice that this really focuses the movement on our lumbar spine. Really searching out the best possible movement in our segmental range. And try and get one vertebra at a time to move here. Great, 2 more. And last one. Great. Now we're going to go on all fours now, and we want to get a lateral bend of our spine. So we're going to bring our hip here into our ribs. This is our iliac crest. We're going to laterally bend into our ribs. So breathe in and irradiate. Keep your thoracic spine nice and stable. And then we're laterally bending, bringing that crest up to the ribs. Slow and controlled. What movement do you have in the lumbar spine when you laterally bend? So you'll feel your weight shift to one knee to the other as you laterally bend. Great, another 2 reps. Last one. Great, now we need to use our yoga blocks. And this is we're going to place the yoga blocks here, and we're going to place the yoga block just under our thoracic cage here to about our L1 segment. So we're going to really isolate our lumbar spine here. I'm going to place this up for me, and we're only moving our lumbar spine, and we're keeping our thoracic spine stable. We don't want to move our chest off these blocks, and our chest here, just under our rib cage, we shouldn't feel any movement there. We want to keep that stable. Start off an extension, breathe in and irradiate, and going into flexion, only moving that lumbar spine. Three, 4, 5, slow and control, 6, 7. Try and do about 10 reps of each of these exercises. 8, 9, and 10. Great. So to really isolate the segments that we might be having trouble with, we're going to use a band for this. Place the band down the lower part of your spine. Doesn't really matter, we're going to be working on two areas. You can go on your knees here, or you can sit on the edge of a chair doing this if you find it uncomfortable with your knees. But breathing in and irradiate, starting off in extension, so anterior pelvic tilt, and then we're going to be pushing into the band at that segment, really focusing our energy and movement just at that segment. So we want 10 reps here. Slow and controlled. Okay, I want that segment only to flex and extend. Or just focusing our energy there. I think we're up to 5 there. 6. 7. 8. 9. 10. Good. Move the band up in a different area of our lumbar spine, starting off in extension, breathing in and irradiate, pushing the band out as we go into posterior pelvic tilt and then anterior pelvic tilt. We should feel our sit bones move underneath our heels as we go into anterior and posterior pelvic tilt. 5, 6, really slow and controlled, squeezing that anterior and posterior pelvic tilt at those end ranges. 8, 9, and last one, 10. Squeezing that out. Okay, now we're going to do some hinge point work. We're going to work on individual vertebra. We're trying to push our spinous process into the sock while we're laying on the sock. That's going to give us our neuro input of where we want to work that segment. So I'm going to place this sock on the lower lumbar spine. Okay, as I'm lying on it, I can sense where that sock is. That's where I want to focus my energy and movement of the spine. Breathing in and irradiate, and 10 reps here, pushing into the sock. This is going to be really subtle movement. You won't see me do much movement here. We just want to feel that spinous go into the sock and come away from the sock, and only moving that segment. Another 4 more. 1, 2, 3, and last one, 4. Great, let's work up the spine just a little bit to our upper lumbar spine, feeling that sock. Okay, I can feel it at a different point on my lumbar spine now. Breathe in and irradiate, and 10 reps here, pushing the spinous into the sock. Retraining our nervous system to build those neurological connections, neuromuscular connections to that specific segment we want to retrain. We're flexing and extending over that point. Another 4 now. 1, 2, 3, and last one, 4. Great. Now we end with our spinal segmentation work. Breathing in and radiate. Start off an extension. Initiate from our lower lumbar. One segment at a time. We're going to come up into our thoracic, squeezing up into extension, into flexion. Initiating from the lower lumbar spine into extension, anterior pelvic tilt. Squeezing up into that extension. Again, flexion. Flexing the spine, coming all the way up. Anterior pelvic tilt, one segment at a time. Okay, another 4 more. Two, and last one into flexion. And back into extension. Great, fantastic, well done. Consistency is the key, but this is the foundational work for our spinal health. If we don't have that individual segmental control and ability to flex and extend, then we don't have very good spinal health. So these need to be done every day and be consistent with them, and you'll get some great results.